Hello everyone, welcome to HW News. Today in this video, we are going to talk about the issue of underreporting of COVID deaths in India and particularly in a state of Gujarat. But before that, if you are watching this video on YouTube, please make sure you subscribe to our channel, you like this video and you comment below it. And if you are watching this video on Facebook, please do like our page and share this video to as many people as possible. The second wave of the pandemic has shaken India. Almost every other household has seen COVID case or worse, COVID death. We continue to say that those who are dying of COVID are not just mere statistics. They were living, breathing humans who had dreams, ambitions, emotions, maybe big plans for their future. But the pandemic snatched that opportunity from them. That's sad. But you know what is sadder? Not even getting the acknowledgement that you are a victim of the pandemic, when the official data does not even acknowledge this. There have been multiple reports, multiple reporters across the country have gone to the cremation sites, to the burial grounds to cover how many people are being cremated or buried with COVID protocol and how many numbers is the state reporting as COVID deaths for the particular day. And the difference is staggering. This leads us to the larger issue of underreporting of the COVID-19 deaths in the country. This data that will help us assess the true gravity of the pandemic and how it has impacted a particular state or a city. One such state where the state media is constantly raising the issue of underreporting of COVID deaths by the government is the state of Gujarat. In the past, the newspapers have published pages full of obituaries for those who died of COVID-19 to inform people how many of them have actually died due to the infection. But a new report reveals what is the true extent of Gujarat's COVID deaths as against the government data, and the numbers are no less than shocking. On Friday, Gujarati daily Divya Bhaskar published a report which said that Gujarat had issued 1,23,000 death certificates between March 1 and May 10th compared to 58,000 certificates which were issued in the same period last year. According to the report, the government issued 65,000 more death certificates in the March 1st to May 10 period this year. However, it also said that Gujarat government data showed only 4,218 patients had died of COVID-19 during the same time frame. The report, which is in Gujarati, has been translated into English by journalist Deepak Patel. He then listed district-wise details of death certificates issued between March 1st and May 10th as against the government numbers. So I am also going to tell you the same. Whatever data is being shared is for the period of 71 days between March 1 and May 10th, 2020 and 2021. So let us first start with Rajkot. In this time frame, Rajkot city issued more than 2,500 death certificates in 2020. However, in the same period in 2021, the city issued more than 10,800 death certificates. However, according to Patel, Gujarat government data says that only 288 people died of COVID-19 in Rajkot city in the same period. Let's talk about Bhavnagar. Last year, in the 71-day frame, Bhavnagar city issued 1,357 death certificates. This year, it issued more than 4,100 death certificates in the same 71-day period. Now, Gujarat government says that only 134 people have died in the city in this frame. Let's talk about Ahmedabad. Ahmedabad city issued more than 7,786 death certificates in the 71-day period between March 1st and May 10th. However, it issued 13,593 death certificates in the 71-day period of 2021. Now, Gujarat government's data says that only 2,126 people died of COVID-19 in Ahmedabad city in this same period in 2021. Let's talk about Surat. Surat city issued 2,769 death certificates in this 71-day period last year. It issued more than 8,800 death certificates in the same time period this year. Now, Gujarat government's data says that 1,074 people died of COVID-19 in Surat city in the 71-day period this year, which is way less than what the death certificate for this year show us. Let us talk about the Vadodara city. Vadodara city issued more than 2,300 death certificates last year in 2020 between March 1 and May 10th. It issued more than 7,700 death certificates in the 71-day period of 2021. However, the Gujarat government says that only 189 people have died of COVID-19 in Vadodara city in the same time period in 2021. So similarly, Deepak Patel also gave us the numbers of COVID death certificates issued between the 71-day period last year and this year and the numbers put out by the government. For the districts of Jamnagar, Navsari, Amreli, etc., he also spoke about these districts and the number. And again, the story is same everywhere. Now, Divya Bhaskar earlier in the month of April had also published the phone number of the state BJP chief on its front page, demanding how he had got his hands on 5,000 vials of Remdesivir when the pharmacies across the state were facing shortages. It must be noted here that Chief Minister of Gujarat Vijay Rupani earlier in an interview to PTI had denied that the state was not accurately reporting number of COVID deaths to cover up its failure. Instead, he pointed to ICMR guidelines saying that if a comorbid patient dies, then a committee of experts decides the primary and secondary causes of such deaths. He further said that if that committee identifies the main cause of death as a heart attack, then even though the patient was infected, such death is not counted as caused by coronavirus. The same system is followed in the entire country. However, under U07.1, World Health Organization's International Classification of Diseases Code, this approach is incorrect. Even the ICMR guideline makes it clear that even if a COVID-positive person dies without symptoms of the disease, the death should be recorded as a COVID-19 death. It is important that the deaths due to COVID-19 are accurately attributed and recorded, since it is a part of the mortality surveillance and provides significant information about how the disease is progressing in the population. On Friday, China also revised the death toll in Wuhan city, increasing it by 50%. So, with the infection spreading to rural areas, there is much larger concern over those cases not being reported because there is lack of infrastructure to treat them, let alone record the data. Thus, it is very, very important to bring absolute transparency to the COVID-19 data in the country. Do let us know what you think about this in the comment box below. For more news and updates, you can log on to www.hwnews.in.
Namaskar. We asked you to support us and we are overwhelmed and grateful for the kind of support you gave us. A lot of you all told us that you find it difficult to support us through Facebook or through YouTube and you would like to directly come and take subscription on our channel. A lot of you all said that you wouldn't prefer to pay through credit cards but rather have other methodologies. A lot of you all said that you want a one-time payment option, one-time subscription option. So we arranged for all of that. All of that has been arranged for. We have now multiple payment options. We have UPI, we have Paytm, we have credit cards, we have net banking, we have wallet. We have a lot of payment option now. We have a one-time subscription option. And all of this is now available on our website. The link is down below. And our website, of course, as you know, is www.hwnews.in. Mind you, with subscription, we also have a lot we offer you. So you have exclusive programs, you have exclusive meet and greets, you have exclusive goodie bags, a lot of it that we give for each subscription. All of those details are there in our website. So please go to our website and if possible, subscribe to us. Till I see you next time. Namaskar.